Hello, nice to meet you. I'm Molly Rose Bell, and I have this article, this newspaper, Mind and Body by the Journal Gazette from Sunday, November 16th, 2003, 20 years ago. And what stood out to me was this article at the bottom here. Sit up straight. Good posture corrects many back problems. And so I'd like to read it for you. Go ahead and sit up straight. And I hope that this inspires you in some way and you get something out of this. Sit up straight. Good posture corrects many back problems. By Tara Parker Pope, Wall Street Journal. It turns out your mother was right. Good posture does matter. A growing number of medical complaints, ranging from headaches and neck pain to lower back, knee and feet problems, may be solved by simple improvements in posture. Doctors around the country say they are seeing an increasing number of posture-related health problems, mostly stemming from the fact that more people are spending hours at a time hunched over computer keyboards. Convincing patients that poor posture is the cause of their debilitating migraines or excruciating back pain can be tough. Obviously, many painful conditions are related to physical problems like arthritis or injury, but a surprising amount of pain that can't be explained by other means is because of posture, a condition known as postural syndrome or postural derangement. Patients, quote, want an MRI. They want to look for a herniated disc, end quote, says Daniel Mazinek, medical director of the Cleveland Clinical Spine Institute. Quote, they say it's too simple, that it can't be just posture, end quote. Poor posture triggers a cascade of tiny structural changes and shifts throughout the body that can have painful consequences. The person begins to push the shoulders, neck, and head forward, tilt pelvis, and shift the spine, putting added pressure on muscles and joints. Some experts are using digital photography and specially designed computer programs similar to that used by professional athletes to improve form and performance. The images graphically illustrate the odd angles and positions in which many of us have begun to carry our bodies. Quote, people come in all the time and say, my knees hurt, my back hurts, my shoulder hurts, end quote, says chiropractic sports physician Drew DeMann, director of Manhattan Spine and Sports Medicine, where he uses the photo technology. Quote, but if you look at it from a very mechanical perspective, it makes perfect sense, end quote. Wearing snug-fitting clothes, the patient stands in a relaxed position in the front of the grid-marked board. The doctor dots the body with reflective stickers on the shoulders, knees, navel, spine, chin, and other body parts, then takes a digital picture. The image is fed into a computer program which draws the lines connecting the dots and calculates various angles and positions. Although nobody is perfectly straight or symmetrical, the images do help identify areas that are clearly out of whack. As a long-time complainer of neck and shoulder pain, I had my own posture evaluated with this camera technology. I was stunned to see that I carry my head at a 20-degree forward angle rather than vertical. The awkward posture has the effect of forcing my neck and muscles to bear twice the weight that they would otherwise, a problem that could be corrected with simple stretching and strengthening exercises. About 5 months ago, a 43-year-old fitness instructor, Joe he won't care, sought chiropractic care to treat his aching lower back and tight neck and shoulders. The camera images show that he was carrying one shoulder significantly lower than the other and had a bigger than usual tilt to his pelvis. The prescription? to stop lugging a heavy computer bag, use better posture while working at a computer, and begin a stretching regimen. After 10 weeks, his pain was, quote, much relieved, end quote, says Ogilvy, who works in both Manhattan and Lenox, Massachusetts. Quote, I was surprised how much the pictures reveal, end quote. The biggest surprise about treating posture problems is how relatively easy they are correct with exercises. Quote, while a person is sitting there in the first 5 minutes, I correct their seated posture, and many times they will say, quote, well, that feels much better, end quote. Mazinek says, quote, for most people, if they're faithful with exercises and attention to posture, within 6 weeks you can substantially improve symptoms. To start, a few simple habits like taking 5-second breaks from computer work to stand up, stretch, and take a few deep breaths can help. I'm feeling the urge to do that. Stand up. Much better. Back to the article. Stretch and take a few deep breaths can help. To get a feeling for what good posture is, think of the military cadet standing at attention with his or her hands resting in the small of the back, shoulders and head pulled back and spine straight. But lasting improvements will come only with regular exercise that stretch and lengthen the spine, loosen up tight hip muscles, and strengthen abdominal muscles to take more load off the back. Yoga and Pilates-based exercises, which emphasize stretching and strengthening muscles, often are recommended to improve posture problems. Although research is limited, there is some evidence that the methods can solve back pain and other problems. In a small pilot study of older women who have developed a hump in the back, regular yoga helped them stand taller and improve their reach, function, and mobility, says Gail Greendale, professor at the David Geffen School of Medicine at the University of California, Los Angeles. Vijay Vad. I'm not kidding. Vijay Vad, sports medicine specialist at the Hospital for Special Surgery in Manhattan, has studied a yoga and Pilates-based back exercise program that offers dramatic improvement for participants compared with back pain sufferers who only take pain medication. The key is to stick with it so the problems don't return. Quote, look at the position people spend the whole day in. They're sitting and bending forward doing their work, Vad says. That tends to be a pattern set in your brain. We have to unprogram that. And with that, may we set the intention for the day to consciously sit up straight whenever we can, to take a deep breath and relieve the tension that we may be holding in our neck, in our shoulders, and between our shoulder blades, our lower back, our pelvis, our sweet jaw. I was not consciously aware until a few days ago how much tension I hold in my jaw, and then learning that releasing the tension here releases the tension in your pelvis. It's like a flow of relaxation. Thank you for tuning in.